Hello, and welcome back to another episode of Tech Champions. I'm your host, Daniel Beaty, CTO with AuditMax in Jacksonville, Florida. As you know, we take time each week to sit down with thought leaders and industry experts in the field of technology. We love to hear about their journey and their mission and get their opinion on the latest trends in the industry. We always have amazing guests on the show. I'm especially excited about today. Joining us from Austin, Texas, to talk about technology and healthcare is Sunila Levi. Sunila, welcome to the show.
Thank you, Daniel.
You're welcome. Glad you could join us. So you are currently the Chief Information Officer at Integral Care there in Texas, in Austin. But I know you spent a long time as a developer and have held a number of positions over the years. Can you tell us a little bit about your background and how you got to this point?
Yes. Thank you for that question. And I was thinking about it. I think 24 years. My journey started some 24 years ago, and I came to this country as a fresh engineering graduate. And my very first job was as, like you said, as an application developer, systems developer at Fiserv. It's a financial company, and I spent there developing their email notification system as well, that tied into or integrated with other systems, other financial systems. So that was my beginning. And then just as a desire as a government employee kid, I had a desire to go into the government, and an opportunity came up with Texas Workforce Commission as a systems lead, and working on a system-wide application called Work in Texas. It's still there. It's still working. So started there, and just the inherent satisfaction that you're enabling the citizens of Texas, that was really satisfying at the end of the day. And then just moved from systems lead to systems architect, enterprise architect, and then ended up as deputy CTO at Health and Human Services Commission in Texas. And just had a great experience and opportunities to develop the program-specific applications, just maybe 10 to 20 users, to enterprise-wide, statewide applications like the eligibility system and other systems. So at the state, just enjoyed working for the state. And then currently I am at Integral Care. I am the CIO, CTO for Integral Care. And Integral Care is a nonprofit mental health organization in Austin, Texas. And just to give you guys, give you a high level overview, Integral Care was established in 1967, and we support adults and children with mental illness, substance use disorder, and intellectual and development disabilities. Last year alone, I think we served about 30,000 clients in 45 plus locations with 30 plus varied programs. And one of the services is our crisis services, which we provide hotline for the community. It is a 24/7, 7 days a week, 365 days, the whole year, no downtime. It's a hotline for mental health consultation and suicide prevention. So we provide that services, and which is crisis services. And then lastly, my team and I support about nearly 900 to 1,100 dedicated staff who take care of we take care of the people who take care of the patients and the clients. So of which 130 plus are crisis staff. So it's a pretty big organization. I'm very fortunate to be in this role and learn, as well as play a role of supporting the frontline staff.
Right. Okay. Yeah, that's great, and I love to hear about your journey. What a cool success story. That's phenomenal. I love it. So, and I want you to talk in a minute about the suicide hotline. But before we do that, I'm interested in your take on that digital delivery of care. Right. So pre-pandemic, we'd seen kind of the beginnings of that, at least from kind of the end user perspective. I had seen rumblings of that. I heard of those type of offerings, but obviously that's really ramped up during the pandemic. As we were all stuck in our houses and things of that nature. So can you talk a little bit about how Integral Care has gone digital during this summer?
Yes, absolutely. So we had to move all our clinical services to telehealth services. That was the big change, along with all the staff working remotely. So we moved our clinical services, and then, like I was saying, our crisis line. Last year, we provided 70,000 calls the whole year. But this year, from March to October, I was just looking up at the numbers yesterday, and it was about 170K in just 9 months.
Wow.
So, and the 75K, which is telephone calls as well as telehealth services together in 9 months. So it's almost like I think twice, 200 times fold than what we did last year. So that was a big change. And then this, I think that the good part of the, I mean, I say it in quotes. The good part was we talk about in healthcare, we talk about delivery of care, and the digital delivery really enabled us. This pandemic really enabled us to deliver those services to the client where they are, and not expect them to come into our setting. That was the digital care that really enabled us. And just yesterday, one of the program directors was telling me we provided iPads in state supported living centers, as well as at the where the clients are enclosed in like nursing homes where they cannot get out. And the director was saying, because of this pandemic, it enabled him to the delivery of care transformed where there is fluidity of operations, and the convenience attribute really came into play, where the clinician and the client doesn't have to go into a setting to talk and have a very fixed schedules, but if they can't make an appointment, they can easily say, hey, can we meet half an hour? I can't make it at this time, but can I meet in half an hour? And that fluidity and that convenience aspect of digital care is really helping clients and helping us to deliver the care where they are. Does that answer your question,
Yes,
Daniel?
yeah, that's phenomenal, and I love that because it's, we have seen an increase, unfortunately, in stress level and the need for what you guys bring to the table. So, but couple that increased need with increased availability and accessibility, I think it's a great combination. So, yeah, I love it. That's awesome. And another project that you guys tackled during the COVID-19 pandemic was contact center. So very, very brave of you,
Yeah.
by the way, to try to tackle it during that time frame. But and you mentioned you take I think 70% or so of the suicide hotline calls for the state of Texas, and we know those number of those calls is going up. So talk a little bit about how you went through that decision making process with such a vital service that you guys offer, and with literally lives on the line, right? So talk a little bit about that decision making process and kind of where you guys landed there.
Thank you for that. To talk about that project, so it's 7 out of 10 calls that come into Texas. The National Suicide Prevention Line calls is what we support. Our hotline supports. We are required to take 7 out of 10 calls, and you're exactly right. We did embark on moving to a new CCAS solution, contact center as a service solution. Actually, in the pandemic, we started in April and we deployed by May, and we are working on the new system since May. We've been on the system since May. So, but it wasn't an overnight decision at all. Like you said, we were at it from last year, very, very strategic about it. As the CIO, CTO, my laying out a vision, saying that we just don't want, it's not just meeting the business requirements at this time, but looking for a solution that will help us grow in the future, that will grow with the business, and also aligning the strategy, aligning the technology strategy with the business strategic goals. So business strategic goals, where is the business going, where do the business want to go, and is my technology strategy aligning with the business? I think creating that vision, casting that vision, really brought me the management buy-in. That was the first critical piece. Success criteria or success key factors is to get the management buy-in, and tying the technology strategy to business strategic goals was a successful key factor. And then from going there, going down to technology requirements, not being satisfied with just on-premise and managed services requirements, but really looking at what can cloud solution give us. One of, like you said, our business is about really saving lives, and we need a system that is reliable and scalable as we grow, and available. We don't want to give our clients an engaged signal or a busy signal when they're calling it at that critical time of hope. We need to be available and reliable. So addressing those cloud benefits and then foundational benefits that we get, and wanting to make most of those cloud benefits of security, enhanced security, and looking into it, researching into it around availability, scalability, security, and then other cloud benefits, as well as, okay, what can the system give us now, but what can it give us down the line? So how can we be using the new technologies? How can we, when we bring in a system, will it enable us to be innovative and create value, not just what we are doing now, but what other feature sets can it give? So keeping those things in mind, and then really doing research around who are the leading vendors in this CCaaS market, and then narrowing down, asking those very specific questions, working with them, going back and forth. So it was a very thorough process. It was around 180 plus requirements is what we went through, the exercise that we did with the vendors, and then coming to the decision and recommendation and going through the implementation. And I'm telling you, looking back, we brought the right solution at the right time. So I think that's the success story, and we haven't gone down, Daniel. The system held up from the time of implementation till now. I'm happy to report, and I'll knock on whatever wood is here, but the system is giving the benefits that we were anticipating and wanting, and all that is because we worked as a team, we did our research, and we went through with it.
Yeah, that's great. And I assume your agents are they're all at home, or are not sitting in the physical office, or some of them there as well?
It's a hybrid. Some of them, since this is a crisis, right? They cannot take calls anywhere. There are some criteria that they need to meet in the remote locations. So, but we do have remote agents that are taking calls, as well as on-premise. But 80% is remote, at least at this time.
Okay, gotcha. Yeah, and there's one other question I wanted to ask you. It's kind of related to that, and that is about business intelligence and artificial intelligence. So BI and AI, we read a lot about those these days, and I know that you are making some strides there. So talk for just a minute about some of the innovations in BI and AI that your clinicians and physicians and your company are taking advantage of.
Yes, thank you. This is exciting. I'm telling you, I think I hear a lot of noise around BI and AI, and there is a lot of noise around BI and AI technologies. And some of them even go to the extent of the movie Terminator, very futuristic. But but to my organization, I think we really focused on what is it that we want to achieve with these technologies, and there are some very good technologies. Right now, I'm looking into two specific ones. One is research and study that they did at Brigham Young Women's Hospital, and they are looking at machine learning and business intelligence around kidney risk disease model, taking 6 standard variables and laying out the criteria in that 6 points and then predicting the Disney kidney disease. So I think that's really of value. It's an open source model, which is even better, and so we are building it out. We are trying to build that model out with our data and see how we could use that model to alert our clinicians so they could address it with our patients. So that's one model that we are looking at. And then the second one is we have a lot of data around progress notes. It's a semi-structured data, and progress notes is where a clinician or a psychiatrist sits down and takes the notes when talking to a patient about his or her mental health. And then, so how can we use that data? Appointment after appointment, this data is coming into the EHR system. So how can we do some text analytics and build a mental health model that will help us identify suicide ideation risk? So there are assessments. That there are assessments like Columbia assessment, so but on that one, assessment is just where you are saying that I'm struggling, you or the patient is saying I'm struggling with all this, but then taking the notes, the text analytics, the machine learning behind the scenes, reading it and seeing looking for those keywords, sentimental analysis, and getting to a place where, hey, this patient is at risk of suicide ideation.
Right. No, I think that's great. And I mean, I love to see when technology and health and our personal, our actual personal traits and characteristics and things overlap and intersect with each other. I mean, that to me is amazing. We're not just solving business problems, we're saving lives. So that's great.
Yep.
I love to hear what you guys are doing there. So unfortunately, we do have to wrap up, but I do want to ask one final question we'd like to ask each of our guests that come on the show. What is one characteristic you think it takes to make a tech champion?
I was thinking about it. I'm telling you that from my experience and where I am at this point, I think it boils down to being intentional and to be opportunistic and in using technology to benefit the organization. IT has moved from technology. Technologists are not limited to just IT closets right now, not just the wiring and the cabling, but they have become the critical support organization for any business to operate in this world. And I think this pandemic has shown that and digital world has shown that they're not just operations, but also a strategic partner. So being intentional to meet the business needs and then seeing the opportunities and being opportunistic in using technology to benefit the organization. And in my world, as a nonprofit CIO and service delivering CIO, I think it's the tech champion should be in the healthcare arena should be one who is a social CIO. How are you enabling the client, the consumer, and with your technologies?
I think that's great. Thank you so much, Sunila, for being on the show today. I really appreciate it. If people want to reach out and find out more about you or what you guys are up to at Integral Care, what's the best way for them to find you?
I think my LinkedIn profile, Sunila Levi, and they can search for me for Sunila Levi, and I'll pop up under Integral Care CIO CTO.
Okay, that's great. Well, thank you again so much for being on the show. We really appreciate it. And to our viewing audience, thank you for joining. I'm your host, Daniel Beaty. We'll see you next time on Tech Champions.